When I started in May of 1977, I was a student nurse. The tower wasn't completed, and so we had just the old X building, where we just had 3 floors, and really 2 floors for the patient care.
I remember walking through the tower as it was being built, and they were just sheetrocking the towers. And I remember thinking, boy, those rooms are awfully small. And those ill patients need larger rooms because of the amount of technology, equipment, and the number of caregivers that are needed to respond to their care. I'm very, very excited about the larger rooms in the tower.
So this project really began in 2006. The primary goals of the project were to build a hospital to allow us to provide the absolute best patient care possible for our teams, but also the best experience for our patients.
And if you take a look at what the hospital has done with this new technology facility, the layout, the design, the thoughtfulness, it's full integration for maximum caregiving and also patient recovery, and in the simplest way and the most efficient way possible.
One of the exciting things about moving into the Pedersen Tower is the state-of-the-art equipment that we have, the rooms we have, how they've been designed to be able to provide the very best patient care.
I contracted transverse myelitis back in March. I was then admitted to PCU, and then I was here in neurotrauma rehab for 3 weeks. I was paralyzed from the waist down, so I was here in rehab learning how to walk, how to function. I experienced great quality of care here in rehab. Even though it was a really dark time of my life, I look back on that time with joy and happiness, and I've made great friends.
When I think of Intermountain, I think of people who are doing miracles every day. A miracle that I experienced, a miracle that I've seen on my grandson, and the fact that he was saved. I have deep gratitude for Intermountain, and that's why we were so happy to be able to donate to the hospital and the tower in Provo, to see an expansion of the facilities there so that the access to this type of care would be more universal and it would be easier.
I think it'll provide a more quiet, a more appropriate place for our patients to heal and recover quickly and have their families in the rooms in a more comfortable way. I'm very excited about the building and how beautiful it is. The views are outstanding.
Exposure to natural light for our patients was a big part of this project. If you look out, you can see Mount Nebo, you can see the lake, and if you walk on the other side of the building, you can see Mount Timpanogos.
Having rehab patients in the new facility would be really awesome. Now they'll be able to see the beautiful valley that we live in. And I think it'll be really awesome for them to each have their own room, each space to kind of decompress, get relaxed from all of the therapy of the day, and then able to go and work hard the next day.
The other part is we wanted to make sure we focused on our care teams, the ability for our teams to treat patients from a multidisciplinary perspective. So we've enhanced the communication, implemented tools like Vocera, the Get Well Network. And all of these tools help our teams to communicate, stay connected, and provide the best care we can.
It is a hospital to take care of all of our needs, where we can be serviced here at home. And I think we are so lucky, and I am so grateful for that.
So for a long time, Utah Valley Hospital has provided great patient care, but we've been doing it in a limited box. With this project and the expansion, it allows us to maximize that ability to provide team-based care, and our facilities finally match the excellent level of clinical care we provide.
It comes down to the people who care enough about the community and the people they're serving to do it the right way and to do it with care. I love being part of that.
I am so excited to see the finished facility. And I know there's been a lot of hard work and effort that's got into it, a lot of community support, and we have every reason to be proud of that facility.
The reason my wife and I chose to make a large gift, just in particular in that area, was that we're part of this community, and we intend to be part of the community for a very long time. It's something that's going to benefit thousands and thousands of families for many, many years. They're given the best care possible. That is an organization that I want to be part of, and that we should be so proud of in this community.